Does it sound like it might be on the low side? Actually, all things considered, particularly in this high-tech medical world where things are very expensive often, to make the diagnosis of hypertension requires a blood pressure cuff and a stethoscope. Now, we will talk in just a minute about further diagnosis, about the causes of hypertension. Of course, that costs a little more. But we're going to talk first about this, the tools themselves. Let me go back just. Now, why do I want to talk about blood pressure cuffs? Because some studies have estimated that 1 in 3 blood pressures may be inaccurate. That's a lot. Why is that? Many times it's an inappropriate cuff size. What's important is for us to know what is the measurement of our right arm midway the upper arm. Once we know that, we will then be able to tell our physician or buy our own blood pressure cuff that's the right size. The normal adult cuff is about 11 to 12 inches, and the large adult is about 13 inches. Why is this important? If the blood pressure cuff is too small on the individual's arm, then actually the reading will be inaccurately high. The reverse is true if it's too large. The reading may be too low. Either way, the diagnosis of hypertension may not be made accurately, but it's worse if the cuff is too small, because some studies have shown that there may be as much as a 50 millimeter of mercury change. That means your blood pressure is really 120 systolic, but it comes out to be 170 if the cuff is too small. So because we now have the opportunity to buy our own stethoscopes and blood pressure cuffs at probably at Walmart, I suppose now, as well as at pharmacies, we have the opportunity to manage our blood pressure or to check our blood pressure of those in our family very easily. Or when we go to the physician's office, it's important that we know these things. The next thing is positioning. And I'm going to demonstrate that with a volunteer in just one moment. It's important to have the appropriate position. And usually the diagnosis is not made of hypertension unless you have 2 or more readings at 2 or more visits. Now, this is in general. That is excluding those particular issues where somebody comes in and their pressure is already 210 over 120. These are called hypertensive emergencies, and that's an exception to this rule. But in general, you need at least 2 or more readings. Now, why would you think you would want more than just 1 reading at one time? Nerves, stress. We're going to talk a little bit about some causes. That's one reason I didn't wear a white coat today, so your all's blood pressure would. But right, stress. Just the stress of being in a physician's office is enough. But many times in our busy lives, we haven't just walked there leisurely. We've run to the doctor's appointment in between everything else we've tried to do. And so we get there out of breath and sit down and get our blood pressure taken, and whew, it's a little bit high. Any other reasons? Exactly, exactly. You may have had a cold, and we'll talk about that again in a minute. You may have had a cold, taken a decongestant. You know, you may just not feel well. Any number of things may have happened on that one visit. And to hinge a complete workup of hypertension or high blood pressure on one reading is generally not the best idea. So we're going to have a demonstration, and Mr. Ronnie Syverson, our infection control nurse, has volunteered kindly to come. Thank you, Ronnie, for taking the appropriate position. You see, some patients know exactly what to do. As you see, Ronnie is seated upright Both feet are on the floor, not crossed. His right arm is at, the mid-upper arm is about at heart height, and his arm is resting comfortably on a table or some other flat surface. Now, if I really wanted to take Ronnie's blood pressure today, I would give him at least 5 minutes just to sit here. But I'm not going to make him sit here for 5 minutes. But I would want him to come in and at least sit down, take away the stress component, for one thing, the rushing component, to at least relax at that point. Now we have to choose the blood pressure cuff. So ideally, we would have measured his arm. I actually did that before, and it turns out that Ronnie, because of his muscles, requires a large adult size. So this is the large adult size. But with blood pressure measurement, we have the infant size, we have the child size, we have the regular adult size, and we have what we call a thigh cuff, which is exactly that. If a blood pressure is taken in the lower extremities, then we use this one. Now, we have decided that we want to use the large adult cuff, and I'm going to ask Ronnie if he can push up his shirt sleeve as much as possible. And may I help you? Sure. Thank you. So we're going to get it up here. Now, we're not going to get it so it puts pressure, okay? If the individual has a very tight sleeve and you cannot push it up without really putting pressure on the arm, then please ask them to take off their shirt. Or we should take off our shirt, until we get our blood pressure taken. Now, we want to make sure that we are directly on the skin. And I'm going to take this. Now, see, these are like foolproof because they have writing on them. It says, this side against limb. That always helps us. And it also puts exactly where the artery is. Because in this case, with a blood pressure taken here, we are actually measuring the pressure in the brachial artery. Okay? So I'm going to put it exactly where it says.